Hello class, welcome to chapter 24. I hope you are doing well. And today we are going to be discussing the DNA viruses. So this is the first of two parts that we'll be going through in the next couple of weeks. Next week's lecture will concentrate on the RNA viruses. Today we are focused on the DNA viruses, things like human papillomavirus or HPV. We'll also talk about the Hepatitiviridae today, which are the hepatitis viruses, and then also our Herpesvirus family, which we'll see includes things like HSV1 and 2, as well as varicella zoster, which is the virus that ultimately causes chickenpox and shingles. So let's dive in. Just some general trends about viruses and their role in infectious disease. We have already talked about the structure of our viruses. We know that all viruses contain two major components. First of all, they all have a outer shell known as the protein capsid, and the capsid is made of subunits that we call capsomers. And surrounding that, what's inside the protein coat is actually the nucleic acid. And we know that viruses are either DNA or RNA in terms of their genetic material. We also know that some viruses, specifically the animal viruses, contain an additional layer of host cell membrane known as the envelope. We can further differentiate out DNA and RNA viruses by the structure of their genetic information. So DNA viruses are double-stranded, meaning that there are two strands that are intertwined together, except for one DNA virus group known as the parvoviruses. So this is really important. Parvoviruses are the only member of the DNA virus family that has single-stranded DNA for their structure. The RNA viruses, on the other hand, are just about all single-stranded, except for a group known as the reoviruses, which are the only RNA member that is double-stranded in organization. We also know that viruses are specific to a particular host cell type or cell line. And what that means is we know that viruses have receptors on the outside of their structure, whether it's the capsid or the envelope, things like spikes and tail fibers, which are used to be able to attach to a particular cell type. So, for instance, if you are a virus that impacts the respiratory epithelium, you are going to have very specific receptors that allow you to attach to that host cell epithelium and bind and enter into that cell. We also talk about how DNA viruses enter and RNA viruses enter and multiply within cells. DNA viruses bud off of the nucleus of a eukaryotic cell. RNA viruses multiply and are released from the cytoplasm. And most viral infections are not really that severe. Most are asymptomatic to kind of a mild, and then we have a few that can be life-threatening. But when you think about things such as the adenoviruses, which cause, in some cases, the common cold, getting a cold is not going to have a great impact on your overall health. It's going to be something that's acute, develops symptoms, and begins to decline within several days. And we know that most viruses are strictly human for their reservoir. So they are going to bind and impact humans only. However, there are other viruses that are transmitted from animals by vectors, things like mosquitoes. So we will talk about some of the encephalitis, things like triple E, Eastern equine encephalitis, and St. Louis encephalitis, which are all transmitted through a vector. I also, before we go on, I also want to mention, and I think it's important to understand, again, the ways that viruses are classified. So viruses are classified in three different ways: by their genetic information, whether they have DNA or RNA, by their structure, are they helical, are they, are they icosahedral? What's the overall structure of the virus? And then their chemical composition. So three main ways viruses are classified: genetics, structure, and chemical composition. As we have seen with all of the other chapters, the first set of table in your slides this week are to provide an overview of the connection to the body system for the various viruses that we are going to discuss in our talk today. So there are several medical considerations when we discuss viral diseases. As we've already mentioned, these are the big ones. So the virus's connection to a particular host cell, that's specificity. DNA viruses come off of the nucleus. RNA viruses are released from the cytoplasm. And we've already seen that many viruses are human in reservoir. So most viral infections invade the body at the portal of entry. They cause their primary infection. And we have some viruses that are going to just stay at that portal of entry site and replicate, while others can actually become systemic and circulate to other tissues in the body. And there is a pretty common set of symptoms that manifest from a viral infection. Things like a rash, fever, muscle aches, respiratory involvement. We'll see that a lot of viruses have a respiratory transmission, a droplet transmission. And then we also get swollen lymph nodes. We'll see today that we get some lymphadenopathy in the neck region, where the lymph nodes in the neck become swollen and enlarged. So the body tries to defend this through action of interferon, T cells, antibodies, and oftentimes, depending on the infectious agent, we can develop a lifelong immunity to the viral infection. So most viral infections we have seen are very quick moving. They pass very quickly. And this is the lytic cycle, where the virus gets in, it multiplies, it assembles its new variants, and it causes the host cell to lyse or break open. However, we do have viral infections that can persist for even the course of your natural life. Chronic infections are ones where the virus multiplies at a slow rate and the symptoms are continuously present. Latent infections are ones where the virus enters a dormant phase and is usually not detected through any type of symptom or testing means. However, based on changes to the body, whether it's intensive surgery or you become immunocompromised due to other diseases, the infection can reactivate and reoccur in the body. And one of the ones we'll talk about today is varicella zoster or chickenpox, which can reoccur as shingles later on in life. We also see a lot of times HSV, human herpes simplex virus 1 and 2, that produce sores or lesions and have outbreaks and reoccurrences over time. So we also talk about many persistent viruses are also cancer causing. And we have a term for this. Anytime a virus can transform and cause a cell to become cancerous, we call this oncogenic. Several viruses can also cross the placenta and cause permanent defects. And we have a term to describe this. This is what we refer to as teratogenic. So again, how do we diagnose viral diseases? Well, we can look at the symptoms. We're going to see that primarily viruses in young children are oftentimes diagnosed by the type of rash that they produce. We can grow viruses in tissue lines or in cells or eggs, embryos. Remember that we can't grow viruses in traditional laboratory media. They're obligate intracellular parasites and require a host cell for their growth and reproduction. We can do different types of serological tests where we examine, again, from chapter 17, which you did last week. Serological implies that we're looking at the cells from the serum that are generated in an immune response. So we can look for antibodies that indicate that you have been exposed to a particular viral agent. And there are even tests to look for particular antigens or foreign substances that the body has encountered. So let's start getting into the DNA viruses, talking about many of the different viral families that we are going to get into today. So as we've already mentioned, animal viruses are categorized three ways: their genetic composition, DNA or RNA as their core, their structure or capsid, how that's arranged, and the presence or absence of an envelope. So we have three main categorizations of the DNA viruses. We have the enveloped DNA viruses, we have the non-enveloped DNA virus, and remember that we also have that one outlier, that one member that doesn't fit into these two groups, and that's the parvovirus, which would be considered the non-enveloped single-stranded DNA virus. So that's important to understand, is that that is the one member of this group that does not fit into the traditional categorization. So here's a nice little image that paints this picture for you. So we start with the DNA virus group as a whole, which can then be differentiated out into enveloped and non-enveloped. Enveloped meaning that it has that host cell membrane surrounding the capsid. And then we know that all of the envelope viruses are going to have the double-stranded DNA. So you can see the pink and the blue. The two strands are kind of intertwined together in the core of the virus. These are things like the pox viruses, smallpox, monkeypox, cowpox, the herpes viruses, which are HSV1, HSV2. HSV1 and 2 are distinguished based on their region of the body that they infect. HSV1 are usually the fever blisters or cold sores that form on the lips or around the mouth region. HSV2 is the genital lesions. We also have several other groups that we'll talk about today, such as herpes keratitis and herpetic whitlow. Herpetic whitlow is common to folks in the healthcare profession and is often called a herpes infection of the fingers. We'll also talk about the varicella zoster virus, which fits into this herpes virus family. This is the one that results in chickenpox or shingles. And then we have the hepatinoviruses. And the hepatinoviruses are the viruses that cause hepatitis. Hepatitis A, B, or C. I also want to mention to you that, remember from our earlier discussions, that anytime you see a viral group ending in the suffix viridae, V-I-R-I-D-A-E, viridae, that implies that it's the family of viruses. So, for instance, if we see the Poxviridae, or the Herpesvirus, or the Hepatinovirus, viridae implies that it's the group or family of viruses that fit into that category. We also have the non-envelope side, and we mentioned that this can be broken down as either double-stranded for their genetic material or single-stranded. Our single-stranded, which we'll talk about, are the parvoviruses, which cause a condition known as either Fifth's disease, sometimes referred to as slap cheek disease. And then we also have the double-stranded, which are the adenoviruses, which can cause things like the common cold. And we have the polyoma viruses and the papillomaviruses. Papillomaviruses are the ones that can either cause benign cysts like warts, or there are some cases where HPV can have a cancerous outcome, such as HPV-16, which can cause cervical cancer or cancer of the penis in males. So now that we've done kind of a 30,000-foot overview of the DNA viruses, let's pop in and start talking about these specific groups. So the first one we're going to start with are the Poxviridae, or the pox viruses. So we're starting on the enveloped DNA virus side. So as you set up your table for this particular chapter, what I would do is I would indicate, first of all, if they are enveloped or non-enveloped, and whether they are double-stranded or single-stranded. I would indicate the viral family in your second column. The third column, I would indicate your symptoms. So those are the three big ones that you want to have. And then also, for the fourth column, any type of treatment. So how will the virus be treated? Is there a vaccination? Is there some type of an immunotherapy that would be administered to a patient? So that will help you kind of organize the key details from each of these viruses as you prepare for your exam. So the Poxviridae are called so because they produce these skin pustules that are eruptive. They're known as pox. They often scar over once they heal, and this is the largest group of animal viruses on record. They are all double-stranded, and as we've already mentioned, the DNA viruses are the ones that are specific to the cytoplasm. They have a specificity for your epidermal cells and your connective tissues. So those are the types of cells that they are going to impact. We've already mentioned that they are enveloped. And one of the major members of this group is smallpox. And this was the first disease to ever be eliminated through a vaccination campaign. I believe the last known case of it was in 1977. And the disease is transmitted through either inhalation, so it's a respiratory droplet, or through direct contact in the skin. And the infection includes things such as fever, malaise, rash, toxemia, and even in some cases, shock can occur. And this is broken down into two groups, either variola major or variola minor. And it just is characterized by the virulence, how potent it is. So variola major is going to include things like the toxemia and the shock. So the smallpox vaccine actually uses a single drop of the vaccinia virus that gets punctured under the skin with a double-pronged needle. And the vaccine was introduced in 2002 for anyone in the military as well as medical personnel. There are other pox virus diseases that we often talk about. One of the big ones is the molluscus pox virus, which causes molluscum contagiosum. That's a mouthful. Molluscum contagiosum is significant because it's distributed throughout the world. Highest incidence is usually on the Pacific Islands, and in areas where it's constantly present or prevalent in the population, it's an infection of children. There is direct contact, and there is also fomite contact from inanimate objects. In the U.S., it is most common as a sexually transmitted infection that presents as lesions that are small in the genital area and thighs. AIDS patients who are immunocompromised get a form that attacks the skin of the face and produces these tumor-like growths that occur. So how do we treat the pox viruses? Well, we can go through freezing, we can cauterize them. There are also chemical agents that are available, and just about every mammalian group can actually host a form of the pox virus. Humans being susceptible to monkeypox and cowpox, but none of the others. For humans, monkeypox will give you not only the pustules on the skin, but also fever and swelling in the lymph nodes. Now we move to the second group of the enveloped DNA viruses. So again, if you're setting up your table, first column, you would have your enveloped. Second column, your herpes viruses. And now we're going to talk about some of the specific symptoms and treatments. So herpes virus, as we mentioned at the start of today's lecture, is one of the groups that produces latency. So it can go dormant in the body and relapse at some form. Clinical complications include things such as advancing age, chemotherapy, and other conditions, again, that we mentioned, that the immune system becomes immunocompromised. So those are things that are going to cause the virus to reemerge out of latency. We can also add in things like surgery as a piece that causes a great deal of stress on the body and may cause the virus to come back out of latency. And obviously, anybody who's immunocompromised is going to be more prone for these types of infections. So the herpes viruses, as we mentioned, are double-stranded. They're also icosahedral in their organization, and they replicate within the nucleus. And we've got several different groups that fall into the Herpesvirdae. So as we mentioned, HSV 1 and 2 are the most common. These are the ones, HSV 1 causes fever blisters and 2 causes genital lesions. HSV 3 is the varicella zoster virus, which is responsible for chickenpox and shingles. HSV 4 is the EBV or Epstein-Barr virus, which is associated with things like mononucleosis. This again attacks the lymph tissues. And HSV 5 is the Cytomegalovirus, which infects the salivary glands. We can go even further and talk about HSV 6 and 7, which is often referred to as HHV, or human herpes virus. And this causes a condition in infants known as roseola. HHV 6 typically appears as mononucleosis in adults. You get a mononucleosis-like condition. And HSV 8 is implicated in Kaposi's sarcoma, which is a common opportunistic secondary infection that is seen in chronic AIDS patients. So let's dive into the HSV family a little bit deeper. HSV 1 typically produces cold sores or fever blisters, and they can occur as early as in your childhood. HSV 2 is common in teens to young adults, and this produces lesions on the genitalia. They can be spread orally if there's contact with those lesions. And HSV 2 can be spread without visible lesions. So this is a big one that's often generated from sexual contact. This is table 24.2. This does a really nice job at comparing the transmission as well as the symptoms that are prevalent for patients with HSV. So when we talk about transmission, we often see that transmission occurs through mucous membrane contact with the lesions. So that's important. It's contact and exposure to those secretions that interact with your mucous membranes. HSV is going to multiply in the sensory neurons, and it moves to the ganglia. So HSV1 enters at the 5th cranial nerve. HSV2 enters at the lumbosacral spine that's in the nerve trunk ganglia. So again, these are impacting and remaining dormant in some cases in the nerve ganglia. So again, here's this. We've got this trigeminal nerve here and the ganglia, and this is where the herpes simplex can go dormant and remain dormant for some time. So recurrent infections, we mentioned earlier, are triggered by a whole bunch of different stimuli: stress, injury, surgery, fever, chemotherapy, anything that is weakening or causing massive disruption to the body. We can also get into some of the other variations of herpes simplex 1. And as we mentioned, these can be found in children and adults. We have herpes labialis, again, which is a Fever, blister, cold sore, it's one of the most recurrent infections that we see with HSV1. Specifically, we also talk about herpetic gingivostomatitis, which is found in young children. It is an inflammation of the regions in the tissue in the mouth, such as the gums, the tongue, and the lips. We have herpetic keratitis, which is also known as ocular herpes. And this is an inflammation of the eye, where the virus travels into the ophthalmic region rather than the mandibular trigeminal nerve, where we saw back here. Here's your trigeminal nerve. Again, this, what we see with the herpetic keratitis, is it actually travels into this ophthalmic branch into the eye region. So you get this kind of gritty feeling in the eye, sometimes sensitivity and pain to things like light. Here's a good example for you of some of the fever blisters and cold sores. You can actually see that some of the lesions have also, in that gingivostomatitis state, have entered onto the tongue as well. We also talk a lot about genital herpes, and this is the herpes that forms on the genitalia. And it also is accompanied by malaise or weakness, anorexia, fever, and swelling and tenderness in the groin. We know that we have the vesicles that form on the perineum and the buttocks, as well as the genital. And it can result in things like urethritis, cervicitis, and itching. So those are very common symptoms, like urethritis, cervicitis, and itching. Cervicitis is inflammation of the cervix. And they produce these giant multinucleated cells. So if you were to get in and do a pap smear and do a cervical scraping, you would actually look for, under the microscope, the presence of these fused giant cells that are multinucleated. That would be one of the key clinical indications of infection. And recurrent bouts can occur again from things like menstruation, stress, and also other infections with other types of bacteria. Again, lesions, we're talking about type 2. We're talking about lesions on the surface of the genitals as well as the perineum. These infections can affect neonates, so it is possible for the infection to be passed on from mom to baby during birth, or from hand transmission by the mother to infant. So there is a need to do a preventative screening of pregnant women, and if needed, a C-section to avoid passage through the birth canal. We also mentioned some of the other infections. Herpetic whitlow is a big one, and this can be derived from either HSV1 or HSV2. It is designated to the finger, and it's common in folks who are in the medical fields. And then there is also a very rare encephalitis. It's an occasional complication that can occur, but it's the most common sporadic form, sporadic meaning once in a while, occasional, viral encephalitis in the U.S., and it is extremely life-threatening for individuals that are immunocompromised. So how do we diagnose, how do we treat and control HSV? Well, diagnosis, again, we look at the vesicles, we look at the exudate or the fluid that is produced from those vesicles breaking open. We talked about HSV2, the cervical scrapings showing those giant multinucleated cells. And we can also do culturing tests and antibody tests to determine the specific type of HSV. So all of these herpes simplex viruses can be distinguished through different types of antibody testing. So treatments include things like acyclovir, a lot of the typical types of antiviral treatments. There are medications that can also be applied topically as well. We move on to another very important member of the Herpesvirus family. This is varicella zoster virus, or HSV3 is the specific type. Humans are the reservoir. They are the only natural host that we talk about. And infection can either occur through skin lesion contact or respiratory airborne spread or inhalation. So the primary infection is known as varicella, and this is what we call chickenpox. And it is diagnosed by the vesicles that form. And the vesicles, which are sometimes called a vesicular rash, occur in successive crops. So you find them in patches on the body on different surfaces. The virus can actually enter into the neurons and remain latent and go dormant for a number of years. And due to some type of a stress, the virus can reactivate as the herpes zoster or shingles. And this is extremely common in older patients, but there are other types of bodily stresses that can induce a relapse or reoccurrence. The incubation period for chickenpox is typically 10 to 20 days in length. And again, we discuss latency is oftentimes in those dorsal root ganglia. So here's our dorsal root ganglia. Again, the virus will stay dormant there and can relapse in these crops of these vesicular rashes. This particular case is known as shingles. So we diagnose it through the obviously looking at vesicular scrapings for these giant multinucleated cells. We can also do different types of antigen testing, antibody testing under the microscope, and we can also do culturing of the virus as well. Treatment includes many antiviral compounds. Again, we see the acyclovir, and then also interferon for the systemic version of the disease. And there is now a vaccine called Varivax that is available for folks to get for chickenpox and shingles specifically. So we're going to move into the next group of our herpes virus family. This is the Cytomegalovirus group, or CMV group. And they are typically known for the symptom that they produce these massive multinucleated cells that have inclusions in their cytoplasm. And they are transmitted through bodily fluids such as saliva, mucus, milk, urine, semen, and cervical secretions. They are mostly latent viruses, and most infections are asymptomatic. So you don't even know that you have the infection because there are no symptoms that present. However, in folks who are immunocompromised, there is a very severe infection that can develop, and the symptoms can include diarrhea, so a very severe form of diarrhea, pneumonitis, hepatitis, and retinitis. So that's important to know that in immunocompromised folks, you get a very different set of symptoms than the asymptomatic form, including diarrhea, hepatitis, and retinitis. So we mentioned newborns are in this group of the folks who can get the immunocompromised or more severe form. Newborns can see an enlarged liver and spleen. They can see jaundice, which is a yellowing of the tissues, capillary bleeding, inflammation of the eyes, and it can be fatal for babies. The perinatal CMV infection, we mentioned again, is able to generate, in some cases, pneumonitis, and even in some cases, a syndrome that appears like mononucleosis. Transplant patients, again, who are immunocompromised, we're seeing the big ones, the pneumonitis, the hepatitis, even some cases, encephalitis, which is an inflammation of the spinal cord. And there are antivirals that are available that are reserved for folks who are immunocompromised. But again, CMV we get these giant multinucleated cells that form. All right, our next group of the herpes virus family, the Epstein-Barr virus. This particular virus impacts the lymph tissues and the salivary glands. And typically when we talk about Epstein-Barr virus, one of the glands that it multiplies in is known as the parotid gland. And this is where it typically enters and does all of its multiplication. Epstein-Barr virus can be transmitted by either a contaminated blood transfusion or an organ transplant. It can most commonly be transmitted through oral contact, saliva being the biggest bodily fluid. So we see these a lot in the college-age population, because mono is often referred to as the kissing disease. By midlife, about 90% of all people are infected or have been infected by this. And anyone who's immunodeficient is extremely susceptible to the Epstein-Barr virus. It does have an incubation period of about 30 to 50 days in length. And mononucleosis that we talk about has a set of symptoms that include things like sore throat, fever. There's also a cervical lymphadenopathy, which is a swelling of the lymph nodes in the neck. And these can actually remain dormant in your B cells for a certain amount of time. We also see, besides the lymphadenopathy, we also get a splenomegaly, or a swelling of the spleen as well. There are some other more severe complications that are associated with Epstein-Barr virus. Some of those include Burkitt's lymphoma, which is a malignant or cancerous B-cell deformation, in which there is a swelling in the jaw and cheek region, seen very commonly in young children in Central Africa, and it is co-infected with things like malaria. You can also see a nasopharyngeal carcinoma, where there's this malignancy in the epithelial cells that's seen in Chinese and African men who are later in age. So how do we diagnose Epstein-Barr virus? Well, we want to do blood tests to look at things like lymphocytosis, neutropenia, and any type of atypical lymphocyte that's formed. And we can also do serological tests to examine the serum for antibodies. Treatment is really at the fever and sore throat. There are a series of different types of treatments that can be performed for this, including things like immunoglobulin, interferon, cyclovir, and even in some cases, monoclonal antibodies. We talk about HHV6, which is the human herpes virus 6. Transmission, again, is through saliva. And we mentioned that as adults, this typically appears as a more mononucleosis-like set of symptoms. However, in infants, it results in a febrile disease known as roseola, which begins with a fever and then presents as a maculopapular rash. And there's also been connections to this where it has shown that there may be a correlation between multiple sclerosis and HHV6. The HHV6 actually replicates in things like your T cells and macrophages. So this is targeting those very important immune cells for defense. So that's why we often see things like lymphotrophic. It's targeting and destroying your T cells and macrophages. So again, here's that roseola, that macular papular rash. Clinical studies have also shown a relationship between HHV6 and different types of lymphomas and carcinomas, the T cell leukemia. HHV7 is very closely related to HHV6, and HHV8, which we talked about earlier, causes Kaposi's sarcoma, and it's extremely common as a secondary infection in AIDS patients, where you get the presence of these quarter-sized tumors that form on places like the feet. So we're going to switch gears. The herpes virus family is probably the biggest group that we are going to see in this chapter. We're going to get into and start talking about the Hepatitiviridae, or the hepatitis viruses. And these have a tropism, or an affinity, for the liver cells. So these are targeting the liver. And we also see that the hepatitis viruses cause a necrosis or killing of the hepatocytes. So there's often massive swelling that results as a result of infection. So it's going to interfere with your liver's ability to produce and excrete bile pigments, which causes an accumulation of a substance known as bilirubin. And this leads to a yellowing of the tissues in the eyes called jaundice. So we have many different groups of the hepatitis viruses, and they actually span not only the DNA virus family, but also there are some that fall into the RNA virus family as well. So make sure that you're familiar with which ones are DNA and which ones are RNA. And the trick to this is, hepatitis B is the only member of the hepatitis family that is in the DNA virus category. So hepatitis B is the one that we think of the most. This is, again, one of the major causes of hepatitis in humans. Next week, when we get into the RNA viruses, we'll talk about Hep A, which is the least virulent form. It's a fecal oral contamination, usually from unclean hands that contact uncooked food that is then ingested. Hepatitis C is the most common form with transfusions, so it's bloodborne. Hepatitis E is acquired from fecally contaminated food, very similar to Hep A, and it's the newest identified of the group. And then hepatitis D is a defective RNA virus, and it only infects cells that have already been infected with hepatitis B. So we're going to spend some time talking about hepatitis B. And as we get into our hepatitis group, again, these are still enveloped DNA viruses. They have never been grown in tissue culture. And we've mentioned that they have a tropism, or an affinity, for the liver. Now, when we talk about their transmission, it only takes minute amounts of blood products to transmit the infection. So you could even say that they have a very low infectious dose. Hepatitis B is often sexually transmitted. It can also be transmitted through needles. And when we talk about sexual intercourse, this can be vaginal intercourse. It can also be anal intercourse as well. So there is a incidence among homosexuals and folks who do use and share needles as well. And it increases the risk of liver cancer. So there is, we mentioned earlier, it causes a necrosis of the hepatocytes, which can destroy your liver. So how does the virus get in and do its damage? Well, it enters through a break in the skin or mucous membranes, or by injection into the bloodstream. The virus will then reach the liver cells and begin to multiply. There's about a 7-week incubation period on which the most overt symptoms occur. During this time, patients are going to experience things like malaise, fever, chills, anorexia, abdominal discomfort, and diarrhea. And in more severe cases, you're going to see things like jaundice, rash, and arthritis. And there's a very small number of patients that will then develop the chronic liver disease with the necrosis of the hepatocytes and also the cirrhosis, or liver damage. So again, here's some of the clinical features. We get the fever, the low white cell count, arthritis or inflammation of the joints, pain and tenderness in the abdominal region, this yellowing of the skin and the eyes known as jaundice, enlargement of the liver, that swelling of the liver, and also the possibility of a rash. So how do we diagnose and manage hepatitis B? Well, it's based on a series of serological tests like the ELISA test. There's also immunoassays that can be performed, but it's also making sure that blood and blood products are screened effectively. Same thing for semen that's acquired through sperm banks or organs for transplant. Mild cases are treated by supportive care, and chronic infections are often treated with interferon. There's also a series of different types of vaccinations. So there is the Recombavax vaccine. There's also the Hepatax vaccine, which are two common forms. We mentioned the recombinant interferon, which is often utilized as well as a treatment. And then you can also treat with a immunoglobulin as well. So there is a hepatitis B immunoglobulin that can be administered. So here's our hepatitis B immunoglobulin, and this is for persons that are exposed or possibly exposed. Can also be including the neonates that are born to infected mothers as well. And we talked about the vaccination for high-risk individuals. So the Hepatax and the Recombavax vaccines are often given with 3 different doses over time and boosters to continue to provide high titer levels for immunity. So we're going to move into the other side of our flow chart from earlier and talk about now the non-enveloped DNA viruses. And these are going to include things like the adenoviruses, the papillomaviruses, the polyomaviruses, and then we'll end with the parvoviruses, which are the only group that are single-stranded in their genetic composition. So the adenoviruses are, again, non-enveloped. There's 30 different types that are associated with human disease, and they're only oncogenic or cancer-causing in animals. Their biggest thing is that they infect lymphoid tissue. They can also go after the conjunctiva as well. The transmission is through either respiratory droplets or ocular secretions, and there's often outbreaks that have been seen in military barracks. So we talk about the conjunctivitis. It can also cause the common cold. We see it cause cystitis in young children as well. Severe cases are treated with interferon, and there is a vaccine that is available. The papillomaviruses and polyomaviruses are small and are often containing circular DNA to them. And these can cause either persistent infections and in some cases tumors. So we're going to start with HPV, which is acquired through either direct contact or exposure to fomites. There are over 100 different strains of HPV, and the incubation can be anywhere from 2 weeks to more than a year in length. The most benign form, or least severe form, here are the warts. And these can either be common seed warts or plantar warts that are on the feet. Warts can be removed by many different methods, including topical methods that you can buy in a traditional pharmacy. They can also be cauterized or removed by laser surgery or freezing. And warts can recur. They can also spread from contact from a contaminated portion of the body to a uncontaminated portion. So we talk about things like the common seed warts, which are the ones that are typically found on the fingers. They have kind of a cauliflower-like growth to them. The plantar warts, which are extremely deep and painful and are found on the soles of the feet. And then the most common STI in the US, the genital warts, which produce these tiny flat bumps that can lead to branching cauliflower-like masses. Again, so here's some example. Here's our common seed warts on the hand. We also do have the presence of the genital warts as well. So we do have the benign form, which are the warts. They can also be oncogenic. So there are 9 HPV types that can increase cancer risk. 2 of them account for about 70% of all of the cancers. That is HPV-16 being one of them. So it is all about early detection through pap smears and cervical cell scrapings. And there are 3 effective HPV vaccines, Cervarix, Gardasil, and Gardasil 9, which have already been pre-approved by the FDA. HPV is one of the most common of all of the sexually transmitted viral diseases. And it does have the ability to integrate its DNA into our host chromosome. The polyomaviruses are a viral family that is able to produce a progressive leukoencephalopathy, which basically starts to impact the brain white matter. There are 2 major viruses that fit into this category, the JC and the BK viruses. And these viruses are going to cause either fatal infections, as seen by the JC. We talked about this leukoencephalopathy, which impacts the white matter of the brain tissue. And the BK infections are common in renal transplant cases. And then lastly, our last group we're going to talk about today are the parvoviruses. This is the only single-stranded DNA viral family member that we know of. And they can actually cause conditions in cats and dogs as well. And those conditions can include cardiac infections. And there's very few that cause infections in humans. However, when they do, it is known as Fift's disease or erythema infectiosum, and it's caused by parvovirus B19. And what this will actually look like is it's a kind of a red rash that appears on the cheeks with the presence of a fever, sometimes known as slapped cheek. And in immunocompromised or immunodeficient children, it can actually destroy the red blood cell RBC stem cells. It is able to cross the placenta from mom to baby, so that is incredibly important to be aware of. So they're tied to this, and in the same group as the parvoviruses, there's also AAV, or adeno-associated virus, which is a defective virus, meaning it cannot replicate in a host cell unless the adenovirus is present. So there is a parvovirus known as AAV, which requires the adenovirus to be present in order for infection to occur. So going back earlier, I mentioned to you that when we talk about the rash, most of the childhood respiratory diseases are identified and clinically identified through studying the rashes. That's really, really important to walk away with as we wrap up chapter 24. So with that said, thanks everybody. Feel free to bring your questions to office hours. Again, organize your information in a table that will help you kind of bring everything together and have your information available as you start to study. Organize yourself as the slides did with your enveloped versus your non-enveloped DNA viruses. And that should be a big piece to helping you keep your information organized. Take care, everyone.